Hi, everyone, and welcome. I'm so glad you could join us today. Whether you are here out of curiosity or already exploring this area, you are in the right place. Stem cells might sound like something out of a research lab, and they are, but they are also becoming increasingly relevant in clinical dentistry. So, today's session is all about bridging that gap, understanding the basics, the lab side, and how all of this might translate into practice. Okay, right. Sorry, as usual, just checking that everything is fine. And okay, I'm Dr. Mandana Donahue, founder director of Oral Pathology 360 and the host for Tuesday's live streams on the second and fourth Tuesday of each month, where we talk to you about a range of topics related to oral and maxillofacial diseases and their management. But before we dive in, just a quick reminder that yes. Our channel membership is open, and if you are a YouTube channel member, you will receive a certificate of attendance for today's live stream. If you aren't a member yet and you would like a certificate, it's very simple to join. Just click the join button, which is below the video. And once you've done that, all you have to do to get your certificate is attend the live session. Let us know you are here by interacting with us through the live chat, and then find the link to the certificate form in the members only posts of the channel. You fill out that by tonight, and you will get a certificate within 24 hours. Membership helps us support our educational work, and in return, you get access to exclusive content, certificates, and more. All right, let's get started. We are incredibly pleased to have Dr. Supriya Keur on the channel again. Yes, she's been here before with a very interesting lecture on oral submucous fibrosis. Besides being the professor and head of department at Dr. D.Y. Patil Dental College and Hospital, Pune, she is also the in charge of the regenerative medicine laboratory, bridging both clarity and depth to this topic. Hello, Dr. Supriya, and welcome. Thank you so much for joining us and for making the time to share your insights and your with our audience today. And let me see, I can bring her in. Oops, we lost her. Okay, here she is. Right. Thank you for joining. Yes, but why can't I hear you? Try speaking. Yes, hello, Dr. Alexander, and hello, everybody. We are having a minor problem, as you can see. So let's watch the lecture, and then we'll get back together and we will talk with Dr. Supriya.
Greetings everyone. At the onset, I wish to extend my gratitude to Dr. Mandana Madam and the entire Oral Pathology 360 team for giving me this platform to share my first-hand experience of stem cells and their use in dentistry. I shall be giving an overview of stem cells in dentistry, the science, the practice, and the promise. This is the subject I'm particularly passionate about. As we go through the session, I hope to share my experiences and insight, the strategies that you all can also apply. I became in charge of Regenerative Medicine Laboratory in 2018. I consider myself very lucky to be presented by this opportunity to explore the role of stem cells in dentistry. In the era of regenerative medicine, stem cells are poised to revolutionize various aspects of clinical practice, from periodontal diseases and tooth loss to oral cancer and mucosal lesions. Their regenerative capacity offers the promise to healing tissues that were previously thought to be irreparable. These would be the broader headings under which we would be discussing our topic today. Cells are essentially having the potential to differentiate into any other cell type. Self-renewal means that they can divide and produce cells and persist throughout the life. There are three types of stem cells that we have: It could be the embryonic stem cells, the adult stem cells, which we are going to be discussing in detail, that is the mesenchymal stem cells, which are also now known as medicinal stem cells. And you have artificial, man-made, induced pluripotent stem cells, so that you have a reservoir of the cells that can be differentiated and used as required. Let us look at what are the exact criteria which describe mesenchymal stem cells. If you look carefully, there is something known as plastic adherence. These cells, when grow into the lab, should adhere to the flasks, or that is, should adhere to the lower layer of the flask. They should express the cell surface markers, that is CD105, CD73, and CD90 more than 95%, and should not express the hematopoietic stem cell markers, that is CD45, CD34, which is a pan-leukocytic marker, CD14, CD19, and HLA-DR. They should also be able to show tri-lineage differentiation. Because they are mesenchymal stem cells, they should be able to differentiate into an osteoblast, an adipocyte, and a chondrocyte. One wonders as exactly how do these mesenchymal stem cells bring about the molecular, cellular, and architectural changes. They do so by physically transforming into the cell type that is required, or by the release of these paracrine factors, which we combinedly known as secretome. So these factors modulates the inflammatory cells. They also contain certain chemokines which causes chemoattraction and promotion of endothelial cells, thereby causing angiogenesis. The secretome also consists of various growth factors which brings about the proliferation and differentiation of progenitor cells, and they also release various pro-angiogenic factors which bring angiogenesis. Thus, mesenchymal stem cells bring about the changes, the desired changes by the cells themselves, as well as also by the release of the paracrine factor. This whole jargon of paracrine factors containing bioactive molecules, immunomodulatory molecules, as well as various growth factors, cytokines, and different agents are broadly classified as per their size into exosomes, microvesicular, or large extracellular vesicles. So these are the vesicles or membrane bound proteins which are released. Then there are certain soluble proteins which are released like cytokines, chemokines, growth factors, and proteases. And the combination of the soluble proteins and the extracellular vesicles is your secretome. Cell free yet cell mediated. Thus, oral mesenchymal stem cell secretome have multiple effects. The most predominant ones which can be used in dentistry and medicine are anti-apoptotic effect, anti-fibrosis effect which can be further studied, angiogenesis, antibacterial effect. So we can use stem cell secretome for infection controls, for immunomodulation, proliferation, etc. Thus, current research and clinical trials are exploring its use in wide range of conditions including heart failure, neurological disorders, musculoskeletal issues, wound healing, and even cosmetic applications like hair regeneration. As such, stem cells are present throughout our body. But when we are talking about the adult stem cells or mesenchymal stem cells present in the oral and maxillofacial region, the most prominent one are the DPSCs, that is dental pulp stem cells, shed, that is stem cells derived from the deciduous tooth. You have stem cells present at the apical papilla, periodontal ligament stem cells. You also have TGPCS, that is tooth germ progenitor cells, which are found during the Bell stage of tooth development. You have dental follicle stem cells. You have stem cells present even in the salivary glands, as well as the bone marrow stem cells, which is present inside the mandible. And you also have the buccal pad of fat, which gives you a very good source of stem cells. Let us start with the first part of our discussion today, that is laboratory protocols for stem cell isolation, characterization, and differentiations. These are the four sources from where we could successfully isolate mesenchymal stem cells. They were the pulps of the permanent teeth, pulps of the deciduous teeth, healthy gingiva, and buccal pad of fat.
In case of gingiva and adipose tissue from buccal pad, they were much less technique sensitive as they were soft tissues, so it was easier to isolate the stem cells from there. But in cases of pulp of permanent and deciduous teeth, that is DPSCs and shed, these were much more difficult because the burrs that were used to remove the pulp or split the tooth can cause mechanical and thermal insult to the pulp tissue, thereby reducing chances of survival. Let us now look at the protocol that was followed in our lab while removing pulp cells from the adult and shed teeth. After we have obtained the written consent from the patient and the patient is evaluated for various laboratory investigation, he is asked to rinse with chlorhexidine mouthwash 20 minutes prior to extraction of the tooth, so as to reduce microbial flora and further microbial contamination. Then the tooth is transported to the lab in phosphate buffered saline. Under aseptic conditions, the pulp cavity of the tooth is opened mostly from the crown, or at times, this is from the crown, or at times it is split open. The pulp is then extracted using barb broaches and immediately placed in Dalbaco's modified eagle medium containing antimicrobial and antimycotic compounds. For further procedure, the pulp is washed 3 times in the laminar hood and then it is cut into small pieces, or what we call minced, with droplets of fetal bovine serum in the petri dish. Then the 16 dishes are incubated at 37 degrees Celsius with 5% carbon dioxide for 24 hours. This is also known as explant method. The other method that is used for isolation of dental pulp stem cells is enzymatic digestion. The cells are going to start proliferating around the explant, that is the minced tissue, in this radiating manner. The medium gets changed after 2 to 3 days and the cell growth is continuously monitored under inverted phase contrast microscope. You can see here the same procedure as repeated using a dental pulp from permanent tooth, using shed, using healthy gingival tissue and healthy buccal pad of fat. So the tissues are removed or from the constituent areas, as well as then they are minced then in the form of explant culture, put into the petri dish and flask and incubated. So these are the pieces of the tissue that is present, and all of this will start showing you the cells which starts proliferating as soon as 24 to 48 hours and radiating from the explant tissue. The outgrown cells at 70 to 80% confluence are generally detached using 0.25% trypsin EDTA solution and transferred to a 75 flask where cells are passaged further. Generally, for our experiment, we take cells from the second to the fourth passage. What happens is, initially when the cell starts proliferating, they are a heterogeneous composition. So when we do this repeated passaging, we have more homogeneous population, as that can be seen over here. All the cells resemble thin spindle shaped cells because they are mesenchymal stem cells resembling fibroblasts slightly in the morphology. Once we have isolated and passaged the cells enough, now we need to characterize these cells. These cells are characterized using the cell surface marker characterization procedure, in which we use flow cytometry. So the confluent cells in the flask, which are packed with cells, are harvested and they are washed in phosphate buffered salines. They are further incubated at 4 degrees Celsius with these antibodies for 30 minutes. So we generally use CD73, CD90 and CD105, CD45, CD34 and HLA-DR. So the earlier first 3 sets, that is 73, 90 and 105, are mesenchymal markers, whereas 45, 34 and HLA-DR are the ones which are giving the antigenicity to the cells. So these are hematopoietic markers. We do not want the mesenchymal stem cells are adult type of stem cells. So they are generally characterized by presence of mesenchymal surface marker more than 90% on the flow cytometry when analysis is done. Whereas the hematopoietic markers are minimal, generally less than 2%. So the antigenicity of these cells are minimal, so then they can be harvested from another donor and used by another patient for different clinical purposes. The third and the final step in the laboratory protocols is the tri-lineage differentiation potential of these cells. That is, as a rule, mesenchymal stem cells should differentiate into osteoblasts, chondroblasts, or adipocyte when they are chemically conditioned into. So, like for osteoblasts, the chemical conditioners that we use are dexamethasone, ascorbic acid 2 phosphate, or beta glycerophosphate, and then the cells are incubated with this, and after 21 days we use alizarin red staining for confirmation of the diagnosis. For chondroblast, additionally sodium pyruvate, TGF beta and L-proline are added, and this is the cells are further confirmed by staining with Alcian blue. For adipogenic differentiation, we need to add indomethacin and insulin. And oil red O is the special stain that is used to confirm the adipogenic origin. This is how the cells appear after Alcian blue staining, after oil red O staining, and after alizarin red staining. And these are the four sources. So this is the osteogenic potential confirm, chondrogenic potential confirm, and adipogenic potential confirm. So we have isolated the cells, we have proliferated those cells or passaged those cells, then we have characterized them using flow cytometer or cell surface characterization, and further evaluated their differentiation potential to ensure that they are mesenchymal stem cells. The MSCs modulate the host microenvironment to bring about the molecular and cellular changes. We now know that the cell releases the entire molecular and biological jargon into the conditioned media in the same fashion as they do it in the tissue for signaling the desired biological changes when we inject the stem cells into a particular area. So the paracrine factors which are released into the tissue are similar to the ones which are released into the conditioned media where the cells are grown, and this media is collected, and this is known as conditioned media or secretome. Thus, the use of mesenchymal stem cells are safe and ethical, but the secretome is a cell-free media with no antigenicity. So it is primarily a cocktail of different paracrine factors or signaling molecules or exosomes, extracellular vesicles, you name it. It is a scalable entity which is highly reproducible. So now we have completed the first part or understood the laboratory protocols for obtaining mesenchymal stem cells and conditioned media. Let us now move ahead with the second part of our presentation, that is practice or use of these stem cells. FDA has approved use of stem cells as a drug for many conditions like hematopoietic malignancies, for neurodegenerative disorders, and in a recent event they have also approved it for acute graft versus host disease, which highlights the immunomodulatory effect of stem cells. We have several components of stem cells which have been marketed in Indian markets with Stemputics or QT Sera, which are very regularly using stem cell products, either stem cells by themselves or secretome. Hence, now mesenchymal stem cells are also known as medicinal stem cells. Let us now see how we can use stem cells in dentistry.
Let us now look critically and hopefully at the various uses of stem cell science in translating clinical dental practice. Stem cells can be used primarily for drug screening as a preclinical model, as they are generally normal human diploid cells. Hence, they negate the difference which occurs with interspecies difference which occurs during animal studies. They can also be incorporated as spheroids and organoids and thus helping in drug screening. The second most promising role of stem cells is in therapeutics, mainly in hard and soft tissue regeneration. Let us look at few case studies where stem cells have been used for drug screening as well as in therapeutics. The first basic step in any drug screening or any new dental material screening is the cytotoxicity studies. These studies basically determine the cell viability and proliferation of the cells. The new XYZ material or drug or compound is actually kept in MSC culture plates. Now we can use many or any range of concentration of the drug and allow it to stay for 24 to 48 hours. This is then later compared with a control blank. So these are how cytotoxicity studies are done, which determines the number of death or arrest of the cells or the number of proliferating cells when the compound is in contact with them. So this would give us a clue on the biological compatibility. So there are two types of cytotoxicity assay. One is what is known as MTT assay, 3,4,5-dimethylthiazole 2,5-diphenyl tetrazolium bromide. And the other one is what is also known as cell counting kit 8 assay. Now, we generally perform MTT assay in our lab, and in this, the living cells, after you have kept the compound in contact with the mesenchymal stem cells over a period of 24 and 48 hours, the living cells contain mitochondria, which converts the yellow tetrazolium salts into purple formazan crystals, which are then detected by ELISA reader in terms of absorbance of the material, typically at 570 nanometer. So higher the absorbance means there are more number of cells, more number of live cells which have containing the mitochondria, and thus the color can be converted, and greater the number of viable cells. So this is how we determine that any concentration of the dental material, whether it is viable or whether it is cytotoxic to the living cells. This would form the first basis of the studies, and after this the various other properties of the material are evaluated. The second step during drug or evaluation or drug screening or drug development would be evaluating the differential potential of the drug or the compound. For example, a new graft material, whether it is osteoconductive or osteoinductive in nature, say some Ayurvedic medicine, if they can be used for cartilage repair in TMJ. So what in those cases we do is we take the X drug and we compare it against the standard control, which is the concoction of the same chemical agents that we had used for adipogenesis, chondrogenesis, and osteogenesis differentiation of the mesenchymal stem cells. To this, in the other plate, the drug is added, which is in the concentration that we had evaluated, which is not cytotoxic to the cells. So that drug concentrations are added here and then compared against the standard control. So this differentiation potential is essentially very, very important for the drugs or the materials or the compounds that we are using, which are going to bring about cartilage repair or bone or heart tissue regeneration in dental practice. Thus, this would give a clear picture of the dental material and its biological effects. So this is how mesenchymal stem cells can help us in drug or a new material screening. This slide depicts the study that we did using various luting cements on dental pulp stem cells, mesenchymal stem cells, and evaluated their osteogenic differentiation. Like if A cement or A is better than B cement or A plus B or the combination. And this is done using a direct method and an indirect method. So we can use transwells there to see if the cement comes in direct contact with the cells or there is a membrane or there is something that separates the cement from the cell. So these kind of experiments can be done on dental materials, which are very, very important for development of newer dental materials. This is another example where one of the components of traditional Ayurvedic medicine like Pravar Bhasma was used. And first we evaluated the ideal concentration of Pravar Bhasma that can be used using MTT or cytotoxic study. And then it was further added into the osteogenic differentiation media. And we could show that 100 microgram per ml of Pravar Bhasma increases the osteogenic differentiation of MSCs and causes more bone formation. So some similar studies could be done using MSCs as a platform. So now we can move little ahead or more concerned with dentistry, wherein we can harvest the dental pulp stem cells to produce dentine. So now we are not producing bone, we can also produce dentine by differentiating the MSCs into odontoblasts. This is how bone looks with alizarin stain after 21 days, and this is how dentine looks. So it gives you that floret kind of deposition or globular deposition when it is dentine. So this study, which was done in our laboratory, got published, wherein we evaluated different agents which can increase or induce amyloblastic and odontoblastic differentiation. And we have been able to identify insulin-like growth factor 1, which increases dentine regeneration, creates complex structures that resemble enamel and dentine. Other than this, fibroblast growth factor also stimulates proliferation into neurogenic and odontogenic differentiation. As we move from bone regeneration to dentine regeneration towards cartilage regeneration, there has been reports of exosomal therapy on TMJ arthritis, especially osteoarthritis, whereas there has been an increased cell proliferation and migration with modulation of immune reactivity and increased matrix synthesis. So the exosomes have been used to bring about cartilage repair in TMJ osteoarthritis. So in our lab, we evaluated the various components that can bring about MSC differentiation into chondrocytes. So we used ginger extract 5 microgram per ml for chondrogenic differentiation and found it to be very useful. Similarly, curcumin and rapamycin drugs were also used. We got a article published based on that, wherein curcumin boosts growth of stem cells and has a good action against oxidative stress. And rapamycin drug works on mTOR pathway. So both of these act as chemical preconditioning agents which bring about increased chondrocytic differentiation of MSCs. So then the MSCs, when injected into that site, would bring about more and rapid and very effective cartilage growth at the desired sites. Most of the time, still now, when we have seen the dental materials or agents or compounds that are used containing stem cells or secretome are generally injected into the sites or are applied to the sites so that they are absorbed. The most fortunate thing that has happened, which has boosted stem cells as a therapeutic agent as well as a drug screening platform, is the use of scaffolds. Now, scaffolds can be nano or microparticles, or they could be hydrogel matrix, but they are responsible to give the infrastructure or the mechanical strength to the stem cells when they are incorporated into a microenvironment to bring about the desired site. So this could be the way stem cells are used to treat TMJ disorders in futures, either alone or along with a suitable scaffold. The next type of studies that can be easily done on mesenchymal stem cells are the effect of dental material on senescence or aging. Because if some drug is inducing senescence or bringing about senescence or aging of cells, it can be evaluated easily. Here what we do is we take control. For control, we take mesenchymal stem cells in passage 1, passage 8 and passage 15. So here also the aging or the proliferation of cells are there, and then the drug is used. Now senescence can be evaluated using morphological changes, or we can use a assay which is specially manufactured for senescence, like a beta galactosidase assay, or you also have an X-gal assay by Thermo Fisher. So here the senescent cells exhibit nuclear and cellular abnormalities which can be further analyzed quantitatively using ImageJ software. Now this is of growing interest in cancer treatment, in developmental biology, as well as in inflammatory disorders like arthritis. So there are materials which can be evaluated for senescence, and no better platform than mesenchymal stem cells. The other type of effect of the dental material or the products or drug that can be evaluated on mesenchymal stem cells is known as scratch assay. It is a wound scratch assay wherein we create a physical gap in the cultural plate, and then this test is used to evaluate the migration of the cells, which is seen in terms of closure of the gap. So this is of importance in wound healing medicaments, wherein we require to see if the product is mobilizing the cells to migrate and bring about the closure or healing of the tissue. Like in cases of reepithelization of medicaments in case of for erosions or ulcers. It can also be used to evaluate the effect of various anti-inflammatory drugs wherein the immune cell migration can be evaluated. This is done at 6 hours and 24 hours. It's a very simple in vitro test wherein migration of cells can be evaluated using MSC play. Coming on to the last and the most crucial part of our presentation, that is the promise of use of mesenchymal stem cells in dental procedures and dental diseases. So there are 4 case studies we will be evaluating today. 3 of them have been developed in our own lab and 1 is developed in another lab. So for the first case study that I would want to show you discuss is the use of dental pulp mesenchymal stem cell secretome for reversal of fibrosis, which we studied in OSMF patients. For OSMF patients, sorry, because we did in vitro study and as well as we did animal study, and now we have registered for the clinical trial of the same. So wherein we have been able to show that the secretome that is derived from the dental pulp mesenchymal stem cells can be used for reversing the fibrosis, which was done by assessing the MTT assay. Then we did cellular senescence assay. We also did reactive oxygen species assay, and we also did animal model analysis for the same. And we've been able to prove that application of DPMSC secretome gel into areas where there is areca nut induced fibrosis. It basically caused reversal of fibrosis, which was further proved by using RT-PCR. The other case study is the use of bio-artificial gingiva. Now, instead of 3D bioprinting gingiva, we've been able to grow the gingival mesenchymal stem cells into 2 compartments, the epithelium as well as the connective tissue, using a collagen matrix. Phase 3 is complete and trial will be commencing soon. The third use of dental pulp mesenchymal stem cells was in mucositis, oral radiation-induced mucositis, where I've been able to form these chitosan patches, for which we also got BIG grant, which can be applied on aphthous ulcers, on radiation mucositis and dry sockets, which brings about re-epithelialization and proliferation of the connective tissue.
This is the 4th case study that I want to show you, wherein adipose tissue is used as the primary source for mesenchymal stem cells. So this source is not based in head and neck area, but the truncal adipocytes were used, and the stem cells derived from adipose tissue were shown to have excellent nerve regeneration and nerve protection effect. So nowadays there has been a lot of work that is done by Dr. Sunil and their lab, and there are various other labs in India which are working aggressively on the use of mesenchymal stem cells to treat various disorders. We are basically talking about dental applications, but other disorders like Alzheimer's, Parkinson's are also being very effectively treated by mesenchymal stem cells. Thus, with this presentation, the main aim was to familiarize everyone with the stem cell isolation, characterization, and differentiation process, and the various way in which mesenchymal stem cells, adult stem cells which are easy to handle, can be used as drug screening platform as well as for various therapeutic interventions in dentistry and medicine in general. I also now take this opportunity to just give a virtual tour of our lab, which is a GMP certified lab. So all the cells that we use in our lab can be used for all preclinical or clinical purposes. And this is the lab. This is our FDA certificate. And these are the various parts of the lab that we have: the cell culture laboratory, the room, the media storage room, sterility testing. So we have 2 components in our lab, A and B. A is where the main processing is done, and B is for quality control and storage. We also run a stem cell training program and an RT-PCR training program in our lab. This is our last slide. Thank you so much for a patient listening. I always like to say that you should be like stem cells. You differentiate yourself from others. Good things or different things will happen only if you take the path less traveled. This is our team. This is Dr. Bhonde sir, who's our mentor, and has been a guiding force. This is my entire team. We have a very cohesive and like minded people in our team, and the scientists, basic scientists, are extremely good. And I would like to extend a lot of thanks to our management and to our college as well as our management for their support, for giving us all the facility, and for believing in it us. Thank you so much. uh, Thank you.
Thank you. That was an amazing presentation. And really, thank you for the presentation and also for the work that you do. It's really great. It's nice. I still can't hear you. I can't hear you. I think just disconnect the headset completely. No, I can't hear you still. Can you just totally remove it from the system, or go to the settings and see in the audio which one of your audio input, what is being used? I can't hear you. Let me see, maybe I'm having a problem. Let me check on my other system. Yeah, try speaking. No, definitely can't hear you. Okay, you play around with that and see what you can find. I will make a couple of announcements. So let me just say, while you all are putting in your questions, which hopefully Dr. Supriya will be able to answer shortly, let me welcome our new member who is also here with us, Dr. Masida. And I'm sorry if I didn't get your name right. Of course, Dr. Patil also just joined us, and thank you to both of you and all our other members who are there with us today. I have to also make an announcement that please save the date for the next International Oral Diseases Case Presentation Conference. We have already got the date in place, 8th to 10th of May 2026. And if you scan this, there's a very short form where you will be able to tell us what you are interested in with the upcoming conference, and also you will get all the best and the first news. And open mic faculty is back. It is on now. It is open to all faculty, whether organization or private practice, wherever you are. As long as you are not a student, it is open to everybody and everyone within the healthcare system, as long as what you're going to talk about is relating to the oral and maxillofacial diseases or health or information. If you scan that, it's also, I have put it in the message in the chat. Also, you can find out what is happening and let us know. The winners, the first winner will get to be a guest speaker at the conference, and the next two will be speakers at the channel. And of course, everyone gets a certificate. Now let's try again. Yes. Okay, now I got to try. Supriya, I still don't hear you. And I can see that your mic is on. All right. See, in the settings, you click the settings, which is below our images, the settings wheel. Then click on the audio, okay, and see what is it showing you for audio input. Is it you may have a number of things. Try clicking on different ones till you see which one works. Sorry, folks, just a few minutes. In the meanwhile, if you enjoyed her lecture, please go and hit the like button. No? Okay, Supriya, let's try something else. You want to call me on WhatsApp and I will play the voice here. Okay, let's see if we can do that. what happened. Mike was off. I'm sorry.
Yeah,
Yes, please answer.
yes, yeah. Please answer. So, Dr. Shetty, what we see, after 1 or 2 days are few numbers of stem cells. So it takes like 7 to 8 days for the cells to become confluent, and then we need to passage them. That means move them away from the lower part of the flask, and then place it in another flask medium. That is a passage. So the second or the fourth passage gives you around 80 to 85% confluence of cells. So it takes at least a 15 days cycle. Uh, am I able to answer your question?
We'll wait for her to
We'll
let
wait
us
for her
know.
to let us know.
Oh, okay. Right. I am going to go to the next question. And to avoid the feedback, I will not read the question. You read the question and answer it.
Uh, Thank you, Dr. Sandhya. Um, Dr. Manya, ma'am has just commented. She has not given asked any question.
Yes, most are just that. Nice presentation. Okay. Okay. I will ask you one question. Mm, just 1 second. Okay. Huh. All right. This is getting a little more complex than usual, but okay, we've got it going. So let me ask you a question. Now, how long can you store stem cells?
We can store stem cells indefinitely. Ma'am, you'll have to put on your mic.
I know what happened. Okay. Try.
We can store the stem cells indefinitely. Actually, we have a working cell bank. So here the cells are stored and preserved at minus 170 degrees. That is at the liquid nitrogen tank, and then they are revived as and when required. So our lab is 7 years old. So we have been able to store cells till for past 7 years.
That's interesting. Okay, we have one more from Dr. Jaykumar. Hello. So why government has not approved stem cell therapy, especially for SMF?
Uh, Good evening, sir. Actually, we have got the clinical trial. We have started the clinical trial registration. So, government is now saying that you start using stem cells at two platforms. One is in replacement of an animal model, and second for therapeutics. So, for the OSMF model, we are using a gel. So, it is a non-invasive method which can the gel seeps into the connective tissue as well as the epithelium, and then brings about the change. So we haven't got any rejections, sir. So I think we once we start the process and develop the drug, we should be able to use it. So it is not that government has not approved stem cells. They are approving more stem cells as a treatment for more and more disorders. Um, uh, so I'm Dr. Supriya. The alizarin quantification is done by image analysis. So the osteogenic, and we also do RT-PCR analysis. That is, we do osteocalcin, alkaline phosphatase assay, and we also do osteonectin. So we have just started doing BMPs also, bone morphogenic protein, so that we can pinpoint the exact osteogenic differentiation. So we had used serum-free media. Um,
Okay. All right. We have mostly finished our questions. We have a lot of comments telling you that it is been a great work and very informative and appreciating the work that you do. So, another question that maybe you can answer is now you mentioned in pharmaceuticals and otherwise. So, can they replace animal models? One second. One second. One second. One second.
you. Yes, Government of India has just come up with a proposal where stem cells are used as preclinical models. So we no longer require to do animal studies barring a few cases and with few exceptions. But they are saying that stem cells, especially organoid cultures, organ on chip, there are so many other modifications with using the stem cells which can replace animal studies in future.
Right. So we have one comment. It's not a question from Dr. Suryavanshi, where stem cell therapy is used for hair regeneration. So accordingly, we should be able to use it in OSMF. Good point. And we have a question, I think. Uh, Hi, Dr. Daniel. Yes. Thank you for the brilliant presentation, Dr. Keur. The stem cells would not be viable to work later if stored at minus 80 freezer. One second.
Good afternoon, Dr. Daniel. No, we have been storing it in minus 170, that is liquid nitrogen flasks only. So then it is easier to revive. Yes, not that minus 80. Our lab protocol is actually to store it in under liquid nitrogen cylinders only.
Okay, this is a very interesting session in many ways, I must say, that we will all remember. Okay, besides your wonderful presentation. Okay, there is some more thank yous. I don't see any more questions anywhere. Okay, one more we have. Dr. Varis Akinshipo is asking, thank you. How do you extract pulpal tissue from stem cell research without destroying it? 1 minute.
Dr. Varis, most of the studies that we have done are on normal tooth, which is not affected by any pulpal pathology. So what we do is we take the burr under aseptic conditions and split the crown and then extract the pulp using a barcode. Then we put it in PBS, take it to a bilaminar or a wet culture lab, wash it again, and then mince it and then use it. So there are times that we get contamination, there are issues with it, but we've been able to overcome it quite successfully. So the pulpal tissue is just, and the patient before extraction of the tooth is asked to rinse with chlorhexidine mouthwash 20 minutes prior. And then we use AA solution also. So our success rate have been quite good. So we've been able to extract the pulpal tissue without destroying it.
Okay. We have a comment, I think, from Dr. Shelley. Mm, totally get it, doctor. Thank you. Usually for me, I can see the first cells at 7th day. Okay. What's it called?
Yes, Dr. Shelley, we just see the extension of the cells initially. So it's not, it doesn't take any less than 15 days for actually to properly get a confluence of the cells. And then the second or the fourth passage of the cells are generally used for the experiments.
Thank you. Good questions, good answers. And it's interesting to me. So many of our ex speakers are today attending. I mean, Dr. Daniel has been on the channel. Dr. Shelley has been here. Um, of course, you have been here before, and who else? So many are here. I remember seeing before. Dr. Sandhya has been on the channel a couple of times. Yes, it feels nice. Dr. Divya, Dr. Bhuvan, I had seen him, Dr. Alexander. Wow, what it's like a gathering of of our ex speakers. What fun. Okay. Then what else? Dr. Vari Zakinshipa would like to contact you for assistance and also whether you can share the video. Not sure what video. Okay. And okay, we have one from Dr. Avinash. What source of stem cells is ideal for therapeutics?
Uh, Thank you, Dr. Avinash. Actually, most of our studies have shown dental pulp stem cells to be the best source for most of the therapeutic applications, though buccal pad of fat had also showed increased angiogenesis as well as osteogenic potential. Shed is known to have more of neurogenic potential, but most of our work was concerning with dental pulp stem cells, and we found it to be a good source overall. Uh, Dr. Chaitanya Jyoti, we have extracted dental pulp cells from diabetic patients. And actually, in our study, we found them to be much better than the cells which were extracted from the normal dental pulp, normal tooth. Because of the hypoxic conditions or because of the diabetic conditions, the cells were under stress and they were able to give better differentiation potential. But so we cannot overcome tooth mobility from it. Like we will be extracting it and probably use it for some other therapeutic application or some drug screening if we want to do it on that. But tooth mobility, we still have not been able to go into that for it. Yes, Dr. Wazi, I can share you the entire procedure video of the. It's over 15 minutes, so I did include it in the presentation. But extracting the pipe from teeth, both adult as well as deciduous teeth, is a little cumbersome procedure, and it requires getting used to it.
So if you're okay, you can give me the video. I can still host it on the channel so everybody can see it. And we have Dr. Barpande sir with us. Hello, sir. And he also says, excellent presentation. And okay. And now we are almost out of time. We have just 3 minutes. Excellent discussion, I must say. Good interest. Yes. Okay. Let's go on and give you your certificate. Yes. Thank you so much. In case you want to say
In case you
anything.
want to say anything. Thank you so much, ma'am. Thank you, everyone, for patient listening. And I really would appreciate in case somebody wants to contact me, and then we can have a collaborative study, or we can have further discussions on, and probably come up with a better product or a better procedure for our patients. Uh, So for the gingival model, we had taken the chorioallantoic membrane as well as the collagen membrane. So it was a little difficult because extracting epithelial cells or converting into epithelial cells is a little difficult. But then now we are coming up with this 3D bioprinted gingival, free gingival models as per the scan model of the patient requirement. So it is technique sensitive, but if you want, we could share you that product because we have not been able to go into clinical trials. So I have not in detail discussed the entire thing. But it is technique sensitive, but it is a very doable thing. Dr. Gauri Shankar, we can the cells that we revive are very good cells, but there are no cell lines, sir. These are the cells, primary cells only, which are frozen and then revived at a later date. So if you take it from a fresh source, it takes at least 1.5 to 2 months to get you the whole cells so that you can start the procedure. If we revive it, it takes around 7 to 10 days. So for therapeutic application, both are good. Revival cells also good as well as fresh cells. Uh, we don't have a cell line, sir.
Right. This has been really very nice. And oh, we are seriously out of time. I think we'll do one last question and then we will call it a night. And anybody who wants to get in touch with Dr. Supriya, you can, if you don't know her directly, you can get in touch with me and I will get you in touch. Part of the thing we do at Oral Pathology 360 is connecting people. So, always there for you. And yes, I'll get you this last question.
Good evening, Dr. Patil. Yes, there are three clinical trials that we have starting now. One is therapeutic application of stem cells in type 2 diabetes patients. One is a wound healing patch that we have developed and that we are going to be using for animal models and then further clinical trials. And third is oral submucous fibrosis gel, as well as for oral mucositis, we have developed a spray. So these are the four things that our lab is very consciously working on. And we are also looking at some Ayurvedic formulations for osteoarthritis patients. But each thing takes its own time, and first we have to do the in vitro and the animal studies before we go further into phase 1 clinical trials. But these are the OSMF, diabetes type 2, osteoarthritis, mucositis, and wound healing are what our lab is primarily focusing on.
Okay, everyone, thank you so much for being here and staying with us in spite of our technical problems. And if repeatedly you heard my voice sort of coming across and in a disturbing and rather ear shattering way. I'm sorry for it. Please accept my apologies. And like I said, you can always get in touch with Dr. Supriya through me. And anyway, this was supposed to be the fundamentals. We wanted to keep it simple. I think she will be okay with doing an advanced one after some time. So we can always have her back. And it has been very nice to have everybody here and all of you being here with us. And with that, let's say bye bye. And I remind everybody that we will be back on the fourth Tuesday, that's 2 weeks from now. And this time we are going to be doing something on the easier ways to help patients go through the addiction. And right, so that's about it. Thank you, Dr. Supriya. Wonderful having you with us again. And bye, everybody. See you all. Have a fun time. See you soon.